Hello, welcome to another episode of A Conversation with Villa Springfield. I'm Michelle Hemphill, and today I'm very excited. We are at Advanced Nephrology and Hypertension's offices with Dr. Varghese.
Hi, nice to meet you.
We're going to talk a little bit about the practice and what brings someone to a nephrologist or what exactly it is you do. So tell us a little bit about you.
Nephrology's been in Springfield since about the early 1980s by my senior partner, Dr. George Varghese. We're not related, but he is the godfather of nephrology in this town. He's loved by many and all. And he taught me and my partner, Dr. Eula, kind of, what it means to be a nephrologist in Springfield. And pretty much what that means is we're here for you. Our goal is, we're, by words, we're the kidney doctors. And, if your kidneys ever go bad or there's any problems with your kidneys, we're the ones you want to talk to. We also work on blood pressure because that's kind of goes hand in hand with kidney disease. But, what makes somebody come to one of us? If your doctor says, oh, by the way, sir, madam, your kidneys aren't working like they used to. Creatinine, how we measure kidney function, normal is 1.0, yours is going up. There's 5 stages of kidney disease, and there's stage 1 is normal, stage 2 is pretty normal, and then the 3, 4, and 5 is dialysis. And they might talk about stages of kidney disease, or you need to see a kidney doctor to talk about your kidneys. The most common reasons people have kidney problems is due to diabetes and high blood pressure, and sometimes being overweight. And sometimes all those things are related in a metabolic syndrome. And so the key is, how do we make you better? How do we help you with weight loss, sugar control, high blood pressure? Is there something else going on with your kidneys? Do you have a family history of kidney disease? Did mom or dad end up on dialysis at a young age? Could you have cysts on your kidneys? These are all things that we can treat and help with. Now, there are urologists. Urologists are like nephrologists. Urologists deal with the surgical part of the kidney. We deal with the medical part of the kidney. And we work hand in hand because sometimes when somebody gets a lot of kidney stones, they can lead to infections and problems with stones. And so we kind of go over the medical management of how to prevent stones, and they do the surgical part of the stones. And if you've ever had a stent, you don't want to go back to see them again if you can. So I think, we have great relationships with different doctors. We work hand in hand with the family doctor, different medical specialists. People that have kidney disease have circulation issues, whether that be heart disease, cardiovascular disease, open heart surgery. There's a lot of other things that our patient population has to deal with. When COVID hit, it was an interesting time because for the first month, nobody would want to come to the clinic. We learned what to do with telemedicine. And telemedicine has been great. I mean, in certain populations of patients, those that have a hard time with mobility, hard time with transportation, maybe in a nursing home, with the nurse's help, telemedicine has been great. But nothing beats that one-on-one encounter. And we've been great the last 5 months or so at checking everyone's temperature, asking the right questions, wearing masks. Here we're 6 feet apart, nobody else is in the room, so we don't wear the mask here. But we always wear a mask when we're with patient care and actually anything we do in the office or the hospital. We've been very safe, we've been very fortunate, we've been pretty much back to full capacity in patient care. What we did notice for a little while was sometimes patients weren't going to their doctors, whether their family doctor, their cardiologist, whoever it was. And people were getting sick in the hospital more often than they used to be because they ran out of their medication or they weren't aware their blood pressure was as high as it was. They started developing kidney issues or kidney problems. And we're finally getting back on track to the way healthcare used to be before all this COVID happened. You can feel very comfortable and safe to go to your doctor's office. You can feel very comfortable and safe calling your doctor and doing telemedicine. But the key is don't miss your appointments. Don't think that because you ran out of your meds, it's okay. We're here to help you, and so is everybody else. And the key for you is ask about your kidneys. If you have abnormal urine studies, there's a reason for it. Check on your blood pressure. Check on your family member's blood pressure. Keep an eye on your sugar. If you do the simple things to keep your health good, and I always tell people, if you leave here because I told you, watch your sugar, watch your blood pressure, eat less salt, lose some weight, I didn't give you any magic advice. It's what we should give. And that's the same advice I took on myself. I was bigger than I am now. I had some sleep apnea. I had some diabetes. I had some blood pressure issues. I did things to lose weight. And those are all things that if I had to do it, I tell all my patients, you have to do it. And so we can help you get better. We want you to get better. And working with everybody in town, we'll make it happen together.
Well, and interesting enough, we all know those things. You need to eat healthy, you need to do all that, but we're a weak society. And everything's at our fingertips. And I think with the quarantine in the beginning and with COVID, what do you have but eating at home?
That's
So
right.
I think that, I know myself, I was eating more, and it's like, wait a minute, I got to start paying attention a little bit of what's going on. Now, if you have hypertension, which a lot of us do, and you go to your primary care doc, they do blood work. Is that how you find out if your kidneys are having an issue, and then they would send us to you, right?
Correct. So from a blood pressure standpoint, the primary care doctors do a good job managing blood pressure. Sometimes when somebody needs more than 2 to 3 blood pressure meds, that's when they call us.
Okay.
In the same time, when they're doing all that, they do routine yearly blood work. And the biggest blood test they look at is 2 things. One is the urine, looking for any blood or protein, and a blood test called creatinine, which is how you look at muscle mass in the kidney, or at least muscle mass in the body, but it gives you an idea of the kidney. So when your creatinine level, which is normally should be 1, is up to 1.5 or 2, that number comes with a thing called a GFR, glomerular filtration rate. And when that GFR is dropping and below 60% of what concerns them, that's when they send them to us.
Okay. And if they do come to you, it doesn't mean immediately they're on dialysis. There's things you can do before that, right?
Great question, and yes, 99% of people who come to us are nowhere close to dialysis.
Okay.
Every now and then you'll get patients who, for whatever reason, didn't want to see a doctor,
Sure.
didn't want to get health care, didn't want to know anything was wrong.
Right, because they didn't have insurance.
Didn't have insurance or whatever
Right.
reason it is.
Right.
And they come to us and they are pretty sick, and we have to make some difficult decisions together. And one thing I'll say, as she mentioned insurance, you come to me and my partner, our priority is you come see us. If you can't afford it, don't worry, we'll figure that part out. If
That's
you
great.
ignore your care and your health, you're only hurting yourself, and we don't want that to happen. Going to the emergency room, getting stuck in the hospital, getting all these other bills, come see us, we'll help figure out a plan for you.
And I have read and heard, just like everybody, and the internet sometimes is not our friend because you can get all kinds of information. Do some blood pressure medicines, are they harder on your kidneys, or is it the actual hypertension that's hard on your kidneys?
So first and foremost, the hypertension is the hardest on the kidney.
Okay.
So when your blood pressure is running 180s, 190s, 200s, which we have quite a few people, not only is it hard on the kidneys, it gives you eye disease, gives you heart disease, gets you prone to strokes. So there's a lot of medical conditions associated with it. But you're right. Every medication class has side effects.
Sure.
Beta blockers can cause sexual dysfunction, can mask low sugar. Calcium channel blockers can sometimes make you get swelling in your legs. ACE inhibitors can cause you a cough. Water pills can get you too dehydrated or drop your potassium. Alpha blockers can make you retain fluid as well. Every drug has some level of a good effect and a bad effect. So yes, too much high blood pressure is not good for you. Education about salt and how much salt to put in your body would help. Losing weight would help, but some people need medicine. And there's some level of criteria that says these people need ACE inhibitors, diuretics, calcium channel blockers, maybe a beta blocker, maybe aldactone. There are different classes of medications for different people that we have to look as a group and say, this is the right medication for you.
To treat whatever's going on.
Exactly.
And then potassium and sodium. You keep track of that also. Is that part of the kidney function?
So there are people that have issues with potassium related to their kidneys because they're on a water pill, maybe they're nauseous, they're throwing up, they have diarrhea, or some GI issues, Crohn's disease, bowel disease, whatever it is. And so there's different reasons that people have low potassium or high potassium. If your potassium gets above 6, that's a problem. That can make your heart stop and you go into cardiac arrest. There are medicines we have that helps prevent that from happening, but it's a communication and working together to make that happen. Same thing as you get really low potassium, under 3, 3.5, those people get like a lot of cramps in the legs or get really weak in their legs. Sodium is a little bit different. That can be associated with dehydration or even being on water pills, but sometimes it's its own little problem. People that have some certain cancers can get low sodium. People that have really bad congestive heart failure can get low sodium. So low sodium can be associated with other things. And when if you're a marathon runner and you run long distance, you drink lots of water on the route, those people sometimes fall at the end of the trip because their sodium got so low they get a seizure. So sometimes we have to keep an eye on those kind of things as well.
Okay. And that is done through blood work?
Blood tests as well.
And so you monitor all that for the individual?
For the individual. So when you do the basic blood test, the basic metabolic panel, comes with the sodium, potassium, BUN, creatinine. So it looks at all those things for us.
Okay. And you work hand in hand with the primary care docs?
100%. So if it's something simple and stable, we write a note. We're in the Epic system, which is what most people are on. When we write a note, it goes in real time to the doctor's office. It goes to anybody, including the hospital. So if you ever end up in the hospital, they'll see in real time what we did for you. If it's something a little more serious or you need clearance for a procedure or a test, then we'll call the doctor directly. So you go see your cardiologist, or you go see the interventional radiologist, or you see your cardiovascular surgeon, and then you do an angiogram of your leg because you have an ischemic toe or you have an ulcer on your toe. Sometimes the procedure they have to do involves dye and contrast. That dye and contrast can hurt your kidney function. And so they want us to clear you before you have that procedure and more likely educate you to talk about what are the risks, what are the benefits, what can this do to help you or hurt you.
Yeah, I didn't realize the dye could do that.
Yeah, so we always tell people if you have to put a white milky substance in your IV in your arm, you need to call us before you get that done if you have kidney problems.
Okay.
We always tell people we're your guardian angels. You know, we're there to help and protect you, but you got to call us.
Right. You got to know about it.
Yeah.
And let's go back to the telehealth a minute. You know, some practices need to be hands-on and need to see the person. But it sounds like if they can go and get their blood work, or if they've had blood work, telehealth would be good to check in with.
In a certain population of who we see, especially for follow-up visits, I'm okay with telehealth.
Mm-hmm.
If you're a new patient, somebody we've never met before,
right,
or you're sick, we'd much rather see you in person because I get a better feel for how you look physically, because you might say you feel fine. I might notice you have swelling in your legs, and when you walk, you're a little short of breath when you breathe, and we might get some better insight about how you feel than you might realize. And especially if you have some hard discussions about things, I'd rather do it face-to-face, hold your hand and we talk about it, or at least pat your shoulder, and talk about it before we actually make some big decisions.
Well, sure. And sometimes it's scary. People just, you know, white coat syndrome and all that. Blood pressure. The blood pressure cuffs and the things you buy at the drugstore are accurate, not accurate? Is there a better kind to use if you're monitoring at home?
So
and how often should you do that?
So that is a great question. So if you have high blood pressure or are concerned about high blood pressure, I think the upper arm blood pressure cuffs are better than the wrist cuffs. But for older people especially, the wrist cuff is much easier to use. I tell people, buy whatever you feel comfortable to use and come see me in the office. We'll check the blood pressure on my machine, which is by me hearing with my ears, and we'll check it with your machine. And we'll see how close they are. And if they're pretty close, then we're pretty happy. And I think if you have high blood pressure, you should always check your blood pressure once a day, at least every day, same time every day. And then keep a track of it, twice a day if you need to. And if you're really not sure how the blood pressures are doing, that's when you call us and we'll talk about it.
Yeah, if it seems to be a little askew. And so you can bring in your blood pressure machine and you guys can compare the two with it.
Compare it to my ears and my stethoscope. That's always the gold standard. You know, if I listen to it and I can hear your blood pressure, there's nothing better than that. And if I compare that to your machine and your machine is close, then we're pretty comfortable.
You're good. That's great. Well, what other things would we need to know about dialysis? Now, if you go on dialysis, can you come off dialysis?
So there's some people that have acute kidney injury because, let's say they had a procedure or a surgery, they had pneumonia, infection, their kidneys shut down. There's a good chance their kidneys will come back in a couple of weeks. So those people will come off.
Okay.
If you're a diabetic, hypertensive, you've had other issues, recurrent stones, an ongoing issue that's been going over years, we know eventually your kidneys are going to shut down and fail. When your potassium stays high, when food tastes funny in your mouth, when you're retaining lots of fluid, you're sleeping all the time, food tastes like metal in your mouth, these are signs your body's getting toxicity built up. And the treatment for that is dialysis. And there's two types of dialysis. One that we go to my clinic, you sit in a chair, and you get dialysis through your arm or through your neck 3 times a week. Or there's another one where we put a catheter in your belly. We teach you how to do it at home. No needles, no blood.
Oh, wow.
And you do it every night while you sleep at home. And that's, for people who work or want to be around family, that's a much easier way to tolerate. We also then see, based on your age and your health, if a renal transplant's a good option. It used to be 65 for transplant, then it became 70. Now that's not really a true cutoff in age, but there's kind of some criteria and recommendations. But we set up people either at Toledo, University of Cincinnati, Ohio State. They go there for an evaluation, they talk, they see if there's any donors in their family and friends that are interested. They look and see if it's not an option, do all the proper channels of healthcare to get yourself set up to get a transplant through the system that they have available at each transplant center. And then hopefully in 3 to 5 years get a kidney transplant, get off dialysis, try to live a normal life again.
That's amazing that that can even happen.
100%.
It is. God bless science. And you guys, doctors. When the primary care doc says, I think you need to go see, and we call and we make an appointment and we come in, is there anything we need to bring with us? Or the doctor probably has already, like you said, everything's in Epic.
So whatever is not available, my staff knows to call your doctor's office and ask them to bring it to us. And if for some reason something's missing, we'll get it right there when you show up. So you bring what you can and what you think you need. And if you forgot something, it's not a big deal. We'll take care of it.
That's great. And I guess if you wanted a baseline, or if you wanted to know for sure if you're right on the borderline, you'd welcome an appointment and let them come in just to chat with you.
100%.
And that way you'd have a baseline for where they are and maybe not see them for another year or so.
If there's anything that concerns you, worries you, and your family doctor would feel like a little help would be a little guidance would be helpful, we're happy to see you.
That's great. So the key factors are lose weight, watch what you eat, take care of yourself, and I really appreciate this. Great information. I just have another question. You mentioned congestive heart failure. Does that go hand in hand with kidney failure also? I know there's a fine line with fluid intake and...
So what I always try to tell people is that people in congestive heart failure, they want to live in the desert. You want to get rid of all that fluid as much as possible so you can breathe. The problem is your kidneys are like goldfish. When you take all that fluid away, your goldfish doesn't have much room to breathe. So every time it's a seesaw. Every time you make one thing better, you make the other thing worse. So you got to find a balance. And so we work with the heart doctor to find that balance for you.
Right. That's great. Everything's a balance.
Exactly.
Well, I want to thank you so much, Dr. Varghese, for being with us and talking with us. And hopefully we can come back again and have another conversation. And I get questions from different people. I'll have all your information at the end of the video so you can get a hold of Dr. Varghese or his partner and call the office and get an appointment if you feel like you need to. Or it sounds like you could come in and even just get a baseline and talk about it if you've had hypertension for quite a while.
All correct. I agree.
Great. Well, thank you so much. And thanks for tuning in to an episode of A Conversation with Phyllis Springfield. I'm Michelle Hemphill, and until next time, thanks.